It's Men's Health Month in June, and the Canadian Men's Health Foundation is here to help remind guys that you are never alone. Our latest report shows 1 in 2 men are at risk of social isolation and dealing with higher levels of stress and depression. So let's talk about the tough stuff. Get the tools to build better mental health and use hashtag #NeverAlone and join a national movement bringing men together. Visit menshealthfoundation.ca to get involved.
Jack told me one time, it's important to have a dream that is like kind of bigger than your lifetime because it means you're working on the important things. And I think I feel like that. I turn to that when I feel overwhelmed about how we're going to resolve the issue of men's health here. It's so important and it's so big that we have to do it. And it may take us more than our lifetimes to kind of get there. But let's get started now.
More than half of them experience healthcare barriers. 42% suffer gender bias from healthcare practitioners. They are 3 times more likely to die by suicide. 2/3 report moderate to high levels of stress. 1 in 2 face social isolation. The statistics are shocking, unsettling, and going in the wrong direction. Who am I referencing? Well, there are more than 20 million of us in this country, and yes, I am talking about men. In this episode of our DCM podcast, we're joined by Todd Minerson, Country Director at Movember Canada. Awesome to see you, Todd.
Great to be here, Kenton. Thanks for setting up this chat, and I'm really looking forward to talking about men's health with you.
There is a lot on the plate here today, isn't there? And I wanted to get into the stats in a second, but I wanted to talk a little bit about Movember and the data that you have worked on. The Canadian Men's Health Foundation also worked on data. But first on Movember, more than 20 years later since you were created, more than $1.5 billion, I think, raised for men's health, supporting 1,300 projects worldwide. First, on behalf of men and all of our families, I wanted to say thank you. The annual event, the Growing of the Mustaches, has been a huge success in Canada, and it's helped a segment of the population that, between you and me, let's just say, isn't maybe the most progressive in managing themselves, present company excluded, of course.
Yeah, well, thank you for that, Kenton. And we're also big fans of the work that the Canadian Men's Health Foundation has been doing and the important conversations that you've been having. But probably like you, we're nothing without the, for us, 50,000 Canadians who sign up every year and participate in Movember in one way or another. And I know you also have a huge community behind you based out there in Vancouver and across the country. So, I think we're going to break some myths about men and their health today, but one of them is that they don't care and they don't get engaged and they're not involved. But we know otherwise from the communities that we work with. And I'd be remiss to say if my Mo isn't making a rare June appearance here this time of year, much to my daughter's dismay, whose eyes rolled right back into the top of her head when she saw me come downstairs with me the other day.
You got to live the dream. That's what it's about sometimes.
Yeah, no such thing as a bad mo for a good cause. That's what we say.
I was imagining growing a full head of hair for this meeting today because I seem to have mo most of the time. So let's talk about your latest research. You've been on the leading edge of research. The Canadian Men's Health Foundation just came out with research. I think suffice to say, fairly shocking numbers, but maybe not surprising. Talk a little about why the research now, Todd.
Yeah, so this week for Men's Health Week, we're releasing our first deep dive into the state of men's health here in Canada. It's called the Real Face of Men's Health Report. We've had the luxury of doing this report last year in Australia and the UK, and we've seen how vital it's been to kind of spark conversations about men's health and about changes, which is the most important part for us. And so we kind of found 4 thematic areas, Kenton, in the research this year. And obviously, there's a huge amount of substance behind it and detail and nuance and complexity, but we're taking away 4 main things. And the first is that, unfortunately, men are still dying too young. 44% of men are dying prematurely. In public health terms, that means before the age of 75. And mostly it's from preventable causes for the large part. In real terms, because 44% doesn't sound like something you can really wrap your head around, in 2023, that meant 75,000 men in Canada died prematurely. And that's just something that we can't accept anymore. We have to work on changing, especially if it's largely from preventable causes. The second thing we're learning and we're taking away from the report is that although men are engaging with the healthcare system, largely it's not being very successful in how they engage. We are still facing barriers around stigma, around gender bias, around responsive care, but also as men, we are delaying our help-seeking behavior. We found that almost 1 in 10 men are waiting more than 2 years to seek treatment once they discover symptoms. So there's an element of health literacy and awareness and breaking down those fears and stigmas that we really have to do. The third thing that's really important is there's a ripple effect for poor men's health. And we all know this, but we've been able to do some original research to understand what that impact is. And the cost to caregivers and to the people who care about us in our lives is pretty astronomical. Right now, 2/3 of people who are caring for a man with poor physical or mental health are saying it is impacting their own mental health. And 50% of those caregivers are saying that it's affecting their finances as well. So there's a huge cost, not only to men, but to our whole society for poor men's health. And, we've even done some health economics work that I'm sure we can talk about later on about the cost it's offering to our society as a whole from not taking care of some of these issues.
So can I just come back to kind of the broader issue here? Because as you talk, we're learned people. We have certain capacity to understand challenges and opportunity, and we, the royal we of who we are as a society in Canada. I'm just curious as you talk about, stigmas and you talk about kind of the current state of the manosphere. And even as I say that world, it's going to conjure up, certain negative things driven by, people on the podcast space that maybe are a little more aggressive and kind of getting into that toxic masculinity. I'm just curious, why are we in this state right now where we are so negative on ourselves and more broadly as part of society? What do you see? What is it feeling like to you in Movember?
Yeah, I think some of the challenges that we're uncovering around men's help-seeking behaviors and how the system is working for us, they way predate the podcast world and the so-called manosphere, right? These are issues that go back as far as the ideas of you got to be tough, you can't ask for help, rub a little dirt on it, it'll get better by itself. Like, these are all the things that are there. Also, the lack of kind of positive male role models around proactively looking after our health is an issue for a lot of men as well. So I think there's a heightened awareness now because of some of the media focus on social media and podcasters and masculinity influencers. And we have done another bit of research around that space where mostly we're trying to listen to young men about what it's impacting them, how it's impacting them, and what are the pathways for choosing that kind of to consume that kind of content. But I think when it comes to help-seeking behaviors and men's health, there's actually a lot of things that predate that. And they're a little bit harder to unwind, and they're loaded with fear and stigma and bias and a lack of good kind of pathways and showing people how to do it right that are at the heart of some of that stuff as well.
Yeah, I think you're right. My son is turning 30 actually right now as we speak. And I remember when he was, a kid talking to a psychologist that said the challenge that he will have in his lifetime is the lack of a clear role model, that things had really changed from when you and I were kids, per se. Often for the better, things are improving, but also there's that lack of understanding of what he should be as a boy growing up. And that's really stuck with me. Dr. David Kuhl, who we both know, and we work with him, both Movember and the Canadian Men's Health Foundation. He has a line that says, I can get help any time of the day for my plumbing from my 5 friends. I just call them. If I call them to say I don't feel well, or I'm thinking maybe this isn't, my life isn't working, I need to do something, the phone would all of a sudden go dead, or be like, hello, did I lose you? And there's that perception. I think there's a communication part of this whole conversation. And one of our programs is called Health Check, and that's to help people understand their risk of the 8 chronic diseases that they face. And last fall, we wanted to target younger men because we know if you're younger, if you're in your 20s, that's the opportunity to do the things that your mom and your dad maybe have said about eating better, sleep more, exercise a little bit. And so we wanted to reach out to them to say, hey, come on in to take this questionnaire about your risk factors. And of course, couldn't reach them. They're like, I'm too busy. I'm invincible. And so we thought we'll get you. We'll launch our campaign targeting words like lower your risk. And a psychologist friend of mine said, they don't have a risk, A, and number two, or B, they're going to live forever. They're not going to get the diseases that you got and your dad got. So what's your problem? Why don't you try saying, build your strength, be stronger, and maybe that'll have a better chance of reaching them. So we did that. And we also partnered with a computer company. We went out to say, hey, do you want to win this gaming computer? And guess what? Guess who came in? Those same men came in. They were engaged and they had no problem communicating their fears, their weaknesses, and their strengths. But they were motivated to do that. And I find that enormously challenging in our world. To the things we were just talking about is how do you reach these people who often, and I would include myself in this category, I've gone through my health challenges of cancer, a severe motorcycle accident, and still, I have to get the job done. I've got to talk to 5 more people today, even though my brain right now could be knocking me on the head to say, take a pause, but I have things I need to do. So in your journey, I'm just curious how that's affecting you as a leader of, one of the leading organizations in the world when it comes to these issues of how to address men and how to kind of build the bridge to lead healthier lives.
Well, if you want to start on the personal, also a father here of almost like a few days away from being a 19-year-old son. And in the thick of it as well, but optimistic. I'm going to be really honest. And yesterday, even I was talking to a classroom full of grade 9 boys, and they're ready for these conversations. They're willing. They just need to know that you're actually there to listen.
Yeah.
And you're going to go, as you pointed out, with the work that the foundation's done. You're going to go to the places where they are, and you're going to speak the language that is relevant to them, right? Rather than what we think we know best, et cetera, et cetera. So I am optimistic for young people today. I do think there is a desire for a different kind of masculinity, a different kind of manhood, a different kind of experience. There is a burden on us to understand that young men are connecting. They're connecting in different ways. They are connecting through things like gaming or through, social media and online experiences. In our work around the digital world of young men, we did a lot of listening to young men, and we had trying to understand what is compelling about it. What is the cost of it? When did you feel like it was too much and you had to change? We get a lot of nuance, and we got a lot of depth out of those conversations with young guys, and they're going to be instrumental in helping us kind of figure out how to give them alternatives, how to meet them where they are, how to solve for the problems that they're facing as they experience them and as they describe them to us. And so, similar to you, another way that we've been trying to think about that at Movember is developing youth advisory council here that can help us navigate some of these spaces, to give us direct input and to be really the lead informant on how we engage with young men. And it's a bit, it's a bit extra work, but it is the only way forward, and it's 100% worth it, to make efforts to engage that way.
Manage your stress, not the other way around. For simple ways to improve your mental health, check out the free MindFit Toolkit from the Canadian Men's Health Foundation. Complete a self-assessment, access virtual counseling, and learn more about how anxiety, stress, or depression might be impacting your health. Go to menshealthfoundation.ca and access the MindFit Toolkit to start improving your mental wellness today.
It is. We had a remarkable email back to that story about offering a gaming computer of the person that won the computer. And he was a little older than we thought we would achieve, but he wrote a wonderful note, and that was a note that said, thank you, because he has health challenges, physical and mental, and he had stopped pursuing them, and he was taking up the challenge, and he was going back to see his doctors, and that was because he got involved in our world, and we pushed them. And that's kind of the essence of what we're trying to do through our programs, through our research, through our articles, podcasts, is to reach more men. And yet our research that we just did shows 1 in 2 are socially isolated. And it really is a challenge. I'm finding that on a whole bunch of levels. And one of the things, then some of the most inspiring conversations I have, I'm sure the same with you, are not necessarily with men as much as they are about the women in our lives, be that friends, moms, spouses, or daughters. We had a retreat in Vancouver a little while ago, and a lady came up jovially asking what we were doing, and we explained who we were, and she started to cry. And she was from another country, Belgium. And they don't have an organization that could help men like her son, who's living in his challenges. And she stood there and wept, and she apologized. And for me, that's something that's always resonated about the power of our organizations. And yet, it's so simple, yet so challenging to kind of break over and make the impact. And as I say all of that, I know a large part of what you want to accomplish is kind of reach government. I'm curious from your perspective, where does government fit into this conversation to be more supportive, less supportive, more directive? Because Movember has done some great work in other countries in that vein.
Yeah, I think you know that's a great segue, Kenton, into the fourth theme of our report, and it's that we can't do it alone. Essentially, we've for a lot of years at Movember have been in the prevention space and in the kind of behavior change space, and you folks as well at the foundation. You don't have to change much to make a big difference in your health, right? And that's important. Like, not to dismiss that at all. Like, it's really important that we've got to be accountable and take our own agency of our health and make those kinds of changes. But what we're learning from the research and the data is that alone is not going to, shorten the life expectancy gap between men and women. These kind of systemic responses, the inability of systems to kind of look critically at men's health and the different kinds of needs that are there, to develop ways that are relevant and resonant and culturally significant for men to deal with different kinds of challenges. And, there's a still lack of research when it comes to specifically, gender looks at health, like men's health and some of the unique needs. And you bring up a really, really important as well in terms of the relationship with women. And there's a couple of really important things I'd like to share there. One is, through the caregiver work and the ripple effects kind of data in the research for this report, we are seeing that poor men's health is detrimental to everybody. Women, partners, parents, kids, like there's nobody that benefits from men not being well. And in fact, the opposite is true. When men are well, more people that we care about are well. And so for us, there is this notion of healthier men make for healthier communities. But also, it can be the case, and you must know this from working on the issue of men's health, that people want to make it oppositional or say that, well, women's health still needs focus. And absolutely it does. It's not a zero-sum game, right? It's not one at the expense of the other. And in fact, I would argue that we owe a great debt to women's health advocates and activists about how to understand health from a gendered lens, how to advocate for systems change, how to advocate for resources. And I think there's more for us to accomplish by working together than setting them up in a kind of oppositional way. So
Yes.
that we really are important for us in this report and the work we do.
Yeah, thank you for saying that, because it's really important to us as well. And that, we're in this together. And that's the thing that I keep, reminding people that I talk to, that, we're going to support each other. We collectively will make a difference, but we can't forget any part of the population, any part in the country. And that's the part that we're spending a lot of our time to make sure that the words we use and the programs and how we target people, and none of it is equal to Medicine Hat, that's equal to Sudbury and Toronto, understanding there are local perspectives that are different, and how do we kind of play in that space to be reflective of all men. I'm curious what you feel we can do if you think Canada is at the point of following the lead set by Australia, Ireland, and now the United Kingdom where with our new government in Ottawa, do you think there's a opportunity to drive conversations forward about the collective good of men and women coming together, that together we can help both of us and the entire population to live better, healthier lives? Do you think we're here with Prime Minister Carney, and what's your sense there?
Well, I'm an optimist. I'm going to come out and say it. Controversial statement of the day. I'm an optimist. I think the time is right to have those conversations. We are excited about the prospect of starting them at a systems level with governments, not only the federal government, but provincial governments across the country, and Indigenous governance and Indigenous leadership as well. We're also, the report released from Movember in Australia and UK has been a huge catalyst of two things. One, getting government to have these conversations, but also building more of a network of concerned organizations and individuals and practitioners and researchers to come together and bring these questions to our elected leaders. So I have a lot of optimism, and seeing that play out in the UK and Australia in the last year from the equivalent report in those countries from Movember is a great springboard to those kinds of things happening here. So I'm excited by the prospect. I know it's hard work. I know we have to be patient, and we have to kind of really take the time to engage and educate people about the issue. But I do remain hopeful that we can get somewhere down the road where we have, a national men's health strategy, where we're creating systems in a workforce that are more responsive and understanding of men's unique health needs, where we're bumping up the research in the areas where it's needed the most, and where we're working on addressing some of those shared challenges that are going to make it better for everybody. Yeah. I referenced this health economics piece at the beginning, but I want to drop the number in here, Kenton. The health economics review work that we did in this report show us that poor men's health, this premature mortality issue for men, is costing the Canadian economy $12.4 billion every year.
Wow.
A fraction of that invested in prevention, in upskilling care providers, in doing some research, is going to pay massive dividends to our society as we move down the road. So I'm optimistic that everything is there for us to kind of get to that place where we're making a difference on the policy side.
It's stunning when you say that number, as you look at, not to go too far down the political conversation, the tariffs, the economy, and you think about our trajectory as a country, this idea of building the east-west corridor to compensate for the lack of a north-south corridor, perhaps, with the United States. And you're talking about the billions of dollars, $12.4 billion through better use of our lives and making us more accessible and healthier is an enormous impact. The stat, as you were saying, that really jumps out to me is the 3,400 men that will kill themselves this year, tied to that economy of scale related to their deaths. I don't know how it feels for you. I sometimes feel overwhelmed by the prospect of what we do. I feel overwhelmed as I have conversations with many of the provinces in this fine country, understanding their needs, understanding the challenges that they have. If you look at Saskatchewan and Manitoba right now, and the challenges with forest fires, a little bit of BC as well. There's so many challenges facing us right now. And I try not to get overwhelmed, because I feel sometimes, how do we collectively, lift us all up to make sure that we're not lost, that men are not lost, that women are not lost, that collectively we can make a difference when it comes to picking us up by the bootstraps. And I think there is a role for government as our leaders when it comes to healthcare in this country. I'm just looking for their support and their guidance too. And I'm curious as I say that, I know the Kingdom right now, I think, is the most recent response to the Movember report about the idea of a men's health initiative. What would you say to people listening, watching today, to what they can do to support this movement that we in society, men and women, need to come together? What do you say to them today?
Well, I'm going to do two-parter for you, Kenton, because I want to go back to that feeling of being overwhelmed, and I want to offer up a different political mentor than the one that you brought up, who brings some of that uncertainty and anxiety to our world. I had the great pleasure in a previous life of doing some work with Jack Layton, fine mustachioed fellow, I will add.
Yes.
And
he knew how to do it, didn't he?
You knew how to do it. And Jack told me one time, it's important to have a dream that is like kind of bigger than your lifetime, because it means you're working on the important things. And I think I feel like that. I turn to that when I feel overwhelmed about how we're going to resolve the issue of men's health here. It's so important and it's so big that we have to do it. And it may take us more than our lifetimes to kind of get there, but let's get started now and let's get moving on it. So for me, that's like a, little hope in the uncertain times that we can draw on for that. In terms of what Canadians can do, I mean, from us at Movember, one of the things that people ask me all the time, Kenton, is like, what do you do the other 11 months of the year? What do you do when you're not growing a mustache? And, when you're not supporting all those Canadians out there, raising awareness and raising funds for men's health. Well, here's something we can do, right? This is, our motto is having fun and doing good. And we have a lot of fun in the month of November. It's part of our secret sauce. We can approach this issue in a fun way and really get people engaged like that. Now's our chance to do some good. We would love it for people to kind of download the report, see how it relates to their life, share it if they can widely, get involved with us or organizations like yours about understanding the steps that they can take themselves. But I think we are ready to kind of build a men's health movement in this country. And a movement is not owned by one group. It's owned by the people. It's owned by the people who care about it. And I think there's a real opportunity for us to start that with the work that you're doing at the foundation about empowering men to speak up and take agency over their health. And, the conversations that we hope to be starting soon around policy and around system changes as well. So there's never been something more to do than just, for us anyways, than grow this cookie duster on your lip. But we are, and we're giving people a real chance to get involved and get engaged in, making a better world for men's health.
Well said. Thank you for doing that. That's very inspirational. And you're right. We have a campaign right now that says you're not alone. In society, we're a society that's really focused on your own strengths, your individual ideas. I'm right, you're wrong. And I think what we're missing is this idea of collection, of bringing ideas and people together. And that's why we've kind of landed on a hashtag. We're calling our campaign Not Alone. And we're encouraging people to build their network. It's something as simple as that, because I find a lot of us, might reject the idea of going to see counseling. I can't afford it. It's not right for me. I'm not going to have the right person. And we're trying to really build out this sense of we're in it together. You have a network. One of our champions, Mike Shorman, would talk about this idea of building a network, building 5 friends, understanding one of them probably won't be as close as the other 4. So focus on 4 people in your life and help them really become your advocate and your support network. He had some health challenges. He ended up paddleboarding across all of the Great Lakes to raise money and awareness for mental health. And he's a great advocate in our world, in our space, to take the small things. And that, as things are overwhelming sometimes, it's about the pivot. There's always a flip side to difficult times, and that's the opportunity to make a difference. And so thank you, Todd. I agree. And it is about us collectively coming together. And knowing that we have that power, and that as much as we can talk about government or any other influence on our lives, is that we have to step up ourselves. And I want to just kind of, as we're kind of getting near the end of this conversation, look a little bit to the younger people. There's a lot of statistics around the state of affairs for younger men and younger women. And yet I'm finding, and I'll say this not to say my age, but, I'm a little on the older side now. The openness I find and willingness to do the things that can make a difference in their life. We have a campaign, Don't Change Much. This podcast, Don't Change Much. The idea of don't stop pizza or chicken wings, have one less chicken wing. Have a little more lettuce, but still have a piece of pizza. And it's that balance that we find in our world that it does make an impact. And I'm full of optimism, because these same people that are so inundated right now with suicide rates rising and the challenges as they're starting to live their life, the drug epidemic that's happening, for instance. But yet I find they're open and willing, and they are building their networks. So I kind of live in that space that as much as the older folks maybe aren't so proactive in that space. I'm finding there is a trend that the pendulum is maybe swinging, and we're in a good period of time for our organizations to help drive the change with government and other entities in Canada.
Yeah, I got a chance yesterday to sit with about 20 different grade 9 students at an all-boys school here in Toronto. And, after breaking the ice about how many more days of school left and what are you doing for the summer, and hearing about mountain bike camps and basketball training and fishing and sitting around doing nothing, we got into some conversations about men's health and where their understanding was and where their openness was and what their knowledge base was to start from. And I was blown away by these young men and their willingness to have that conversation, their skill level, their ability to even, say those words. And when we talked with a couple of the small groups, it was like, you guys are going to be set up for a greater chance of success if and when you do encounter mental health challenges in your life, because you're already at a better starting point than us old geezers were. Kenton, I shouldn't speak for you. I'll speak for me. Than us elder statesmen are when we were at that age, right? So that gives me hope. The work that we did around young men's health in a digital world and hearing their experiencing voices gives me hope. And, I think there's just also a boldness and a confidence in younger men to be able to advocate for themselves and to be able to, expect and want better in their lives. And I think we see it trickling through generations. Both of us, we have a little bit older kids, but I'm sure you did fathering different than your dad, and I've done it different than my dad. And I know the guys I see around my neighborhood with like newborns, they're doing it different than I did 18 years ago. So that also gives me a great sense of optimism that there's a desire and a willingness amongst men to change and to do better.
Anything that keeps you up at night? Anything that just sits there in the back of your mind?
I think, like you, a little bit the overwhelming state of the challenge, the diversity of different things that we have to try to tackle, whether it's, suicide rates and mental health or opioid use or, preventative work around certain cancers and whatnot. For sure, gets overwhelming at times to process all of that. I do feel, concern at times about the power of some of these negative masculinity influencers and the difficulty of young people have at times of really critically analyzing what they're consuming there, even for us, and the unspoken power of the algorithms to kind of keep feeding those things to folks. And then I also just kind of worry if the Leafs are ever going to win a cup. So I got lots of, I got a few things that keep me up at night, some more serious than others, Kenton.
Well, can I just say, in spite of the Oilers and their success, there is one team in Canada that does have a maple leaf on their jersey. So as a perhaps Leaf supporter, I hear you, and I wouldn't want to take bets anymore on that timeline. We've been burned too many times. Thank you very much for your time. I too am filled with optimism. As challenging as it can be, the response from men is overwhelming. The little emails, the missives that you get, the conversations that you can start. And I would just challenge everybody listening and watching today, as much as the Canadian Men's Health Foundation and Movember have roles, and we do, to lead the discussion, we're only going to be as successful as the users, the people that are listening and watching. And I would just say, get involved. You're in this to win. You're in this to make a difference in your life and that of your families. And together, and I really want to thank you for your time today, Todd, because for us as an organization, our power isn't going to come from us. It's going to be connecting the dots, about lifting overall with all of the organizations to make sure that everyone in Canada knows that we are here to make a difference, to make sure that we can have the best life possible, because we only have one. We're here one time only. And I really want to thank you, Todd, for your time.
Yeah, thank you, Kenton. It's really great to have this conversation. Admire all the work that you folks are doing, and looking forward to kind of further collaboration and furthering the cause that we both are passionate about.
Awesome. Thanks very much. And remember, it doesn't always take a lot. Sometimes it just takes a little bit. So don't change much.